Awesome. Okay, cool. So for the second meeting, I was a little sick, so I wasn't able to prepare as much. But maybe we can talk about like if there's any updates on like if anyone of the stations like said how many volunteers they need for undergrads, or like any general information that you guys found out this week
So
about
I
the
will
job.
give you like some update that I got.
Yeah.
Um, we contacted, we tried to arrange for the mental health.
Yeah.
Dr. Kaludar, Feruza Kaludar, and Sister Farhat out of the country, so they are not available. But we were able, like, to get with Dr. Afshan. She's a pediatric and adult psychiatrist, and then she said that she will be available. So we are
Okay.
keeping our mental health, and we have, I think. Um, Sister Fauzia, she is now a resident, psychology resident in her first year still, I think.
Yes.
Yeah. She's the mother of Hannah.
Awesome.
So I will contact her like to get her also like to be there. Probably while we are talking about that, like I think we need like to figure like a couple of volunteers for them. So what I want minimum two volunteers per each station. One will be inside the room to arrange for like whatever they need, if they need anything from outside or
Mhm.
something as volunteer. And then one will be outside the room in order to arrange for the waiting people, probably also reminding about the time management because we
Yeah.
don't have a lot of time for that. So that's minimum two. And I
Okay.
think if they request more, probably will arrange for that.
But for the mental health, I think only the provider and the patient. We don't need volunteering inside the room.
Um, if the volunteer is like part of the system, so I think it's fine. It's
Even with our clinic, we don't have any volunteering inside the room
so probably
for the
we'll
HIPAA.
we'll keep them outside
Yes.
the room. Well, it will be part of our clinic. So like if Sister Fauzia is inside the room, she will be like she is volunteering. So
I'm not
she
sure.
might
We
help.
need to check.
That's
Yeah.
fine. So we can probably for mental health like keep the volunteer outside
Okay.
for the sake of privacy for the patients.
Yeah.
Um, what I need is I don't have what equipment they need. Like
Okay.
I purchased for many things for the first aid, um, a lot of equipment, and then I need probably for that first aid, I need three volunteers to teach them how
Okay.
to, because I want to run this station very rapidly. So people will
Yeah.
come, get education, and then just so they can stop by each volunteer. We will have like two tables for that station. Our equipment will be in a row.
Yeah.
So probably I will give you an example. Like we will say how to manage minor burn, like stage one, stage two burn, and
Yeah.
how to manage choking. So we will have the mannequin, and then we will show them how to do the choking. And I even bought like a small, tiny heart compression simulator that
Yeah.
we can show them like how to do that. So so it's a one station, but it has multiple um, functionality, and each functionality need to be run by one of our volunteers. Our main educator for that will be Dr. Abid, who is an ER physician. I think I might be with him helping
Okay.
if nobody is available.
I will just text him if he's available. He can
Yeah, if he's available,
share
he
here.
can join us.
Yeah.
Yeah, he will be the main person because I am missing a lot of those acute injuries that we might need like to help with them. But what I purchased for burn, for CPR and choking. We will not do an official lecture. We will do just a small, hand-on explaining. I think what else? How to manage, how to, do dressing and then cleaning of minor injuries. We are not dealing with deep injuries, just like
Yeah.
injuries. Um, how to probably diagnose stroke, and what do you do for people who get collapse? Just think of attack, and people who are passing out, what we need to do for them. They are healthy, 99% they are healthy. It's just
Yeah.
like hypotension or like heat stroke or something, and then they collapse. So in order not to panic and just deal with that, we're going to do teaching for that. We have, I got from the Sunday school teachers that we have almost 200 students
Wow.
coming. Even, at any day, one of them might get, stomach upset, throwing up or something, and they need
Yeah.
some hydration. So we can teach those things. So I will probably talk to Dr. Abid and then arrange for the teaching material. But I
Okay.
need to assign at least, I don't know, like how many volunteers? Probably 3 volunteers minimum,
Yes.
Okay.
um, for that station, and we need to teach them. They don't know probably a lot of stuff. Those volunteers should be, almost finishing their undergrad or applying for medical school, or even medical students,
Yeah.
medical students. Like they need like to have some education in that. Nurses also will be. I think Ramona is offering like to come, and
Yeah.
I need nurses like volunteer like to be in that station. Okay.
Okay.
Okay. So probably we covered the station um, for the first aid.
Yeah.
So let's go back to like from the beginning. So let's talk about the logistic. So when I put the first picture, that waiting area, it has about 20 chairs that we can put. And I think if we got like probably 20 people on coming on the same time, it's not easy to register all of them. So I will
Yeah.
let them meeting. One of the volunteer, I think Abir suggested is, can we give them a ticket or something so we will know like per order instead of, you know, they will be waiting all of them and we don't know like who will be checked in. So what's the best way to give them a ticket? How we do that? Hmm.
Mhm.
If there is any way that we can probably
Yeah,
say
they
you,
can buy the ticket from the Amazon,
and
and if
then
it's not
each
their
one like will
number,
be
they
like
can give
number.
it.
So
Yeah.
number one, number
Hmm.
two, and then that also will help us like to
Yes.
count how many
Hmm.
people will get.
Yeah.
I got the
Yeah.
thumbs up, so that's from
From
that's from that's good. Okay. Mm.
Yeah.
I like
So
that idea.
probably, yeah, if
Yeah.
you put that and then Manal will
Yeah.
purchase that
Can purchase
ticket.
that one.
Mm.
Okay.
Yeah, the second thing is if you saw um, in the WhatsApp that Brother Mohsen suggested do a registration link. And then I can send that registration link to request to Brother Muhib. He is not with us in the team. I can add him, and he can do that. But I don't know, like what to do with that registration link. Like what's so he said, what information do we need? So I suggested, name, age, email, and probably phone number for those who are 15 and above. Kids,
Yeah.
they don't probably email or phone number.
Yeah.
We need. But if they registered, like who will take care of the next step? We put Manal email, um, just like to
Yeah. Like
as
for any
a
question or something.
for any question. But when they register, what's the next step for their registration? Will they get like an email confirmation? Anything we need to do with that, or just we collecting their names and that's it, so we know how many people? Um, what do you suggest?
Yeah. I think just for the matter of like collecting the people should be enough. I'm not really sure what else we could do with this information, like their name and age and stuff.
Yeah, it might be just probably, I don't know, like if you all agree or something like you need to give me a guidance. Is that helpful? So it's a survey probably for the future. We can
Yeah,
send a like about feedback, or
yeah,
we can probably just know how many kids they came, how many adult they came, like it's just probably for uh, data collection or something.
yeah. I like the idea of getting feedback from them too. If we have like their email, that would be helpful.
Yeah, so if we have an email, we can send them like an email.
Yeah,
And then probably for the phone number, it's easy to text them. They're all from the community, so it's easy
yeah,
to text them like if they need any guidance or something.
yeah.
So I think I will keep that. Do you want like to change? Like, is that okay? A name, age, phone number. Should we say date of birth or age?
Um, Maybe date of birth.
So date of
Yeah.
birth will be more specific.
Yes.
Okay.
Yeah,
Okay. So name, date of birth, email, and phone number for more than 15.
yeah.
15
Uh,
and above. Is it
Yeah.
15 and above? Or do you want like
They
to,
have phone number, say, that are die.
yeah,
okay.
Yeah.
if parents will like want
Mhm.
that or something. Okay.
I was wondering, do you also want to ask what stations they're interested in so we can have like a little estimate of
Oh,
like
that.
how many people are going to go to what station?
Um, the issue is they don't know like what we are offering in those stations. So we are not in, advertising for a lot of um, probably information about those stations. I wonder, most of them probably they will say like we'll try all of them.
Hmm.
And mm, but that's also like a good idea. Like if they need a specific station, like you know, mm, like people who want like mental health or who want dental screening, so we know how many people will come, and then just separate them because I think I will do the mental screening um, in the clinic itself. So it's gonna be like a little bit walking from the building. Well, not walking, it's just like 2 steps or 3 steps, like walking from the building. But it might be a good idea. I don't know. What do you think, Ayla?
I think it's a good idea. I think we can like just get like intake of like how many people are interested in what. It could be cool to maybe one way we could do it is have like check all that apply and list out the stations that we are gonna have. Um, or if we want to also like leave it open-ended and ask them like, what are you trying to gain from this health fair
Okay.
and let them type their answer.
Yeah,
Um,
probably that will be easier one. Yeah. What do you
okay.
want and what do you like from that? And then we will probably know how much
Yeah.
we can focus on which station we should focus versus
Yeah.
what.
Yeah.
Okay. And then we might need just to put like a one, sentence or like 2 sentences explaining what we are doing like for the health fair. If you
Yeah.
are probably, if you can prepare that just in 2 sentence, like in 2 lines
Okay. Yeah.
on the link. So they will read it and then they will probably um, answer what they are interested in.
Yeah.
Then we need to probably prepare that sooner. So
Okay.
whenever we confirm today, I can send Brother Mahir. He can make it probably whenever he's available within 24 hours, and then we can share it.
Okay.
Um,
Are we trying to put it on the flyer, the registration link, or are we just gonna?
I don't think it's easy to put in the flyer. So what we
Okay.
will do is we will share the flyer and then share the link down.
Okay.
So the link will be, easy to click on the link and then it will take you like to the registration.
Awesome. Got it.
Yeah.
Perfect.
Um,
Do we need people like will they have to fill out the registration link to come in to the fair? Like say some people walk in on the day of, would we tell them to fill out the registration link first?
um, the health fair usually you are accepting all walk-in. We
Yeah.
prefer, I think, if we are not very busy, you can just show them the link and then just put their information. It's like when
Okay.
they come to the clinic. So we might
Yeah.
have a couple of people in the waiting area, like or the volunteer, just to help them to register.
Okay.
Okay.
Okay. Got it.
Um, so that will be like the first, step, which is entering the building. The second space, which is the big hall,
Mhm.
that's for the registration itself. So with the registration, we will just confirm their name and where they want to go. If we have that online, it's going to be easy just to
Yeah.
find it. If not, probably we can do it manual. So we need like to prepare a paperwork like for that registration. And then I don't know like what we should put on that, like for the check-in. So we'll say, name.
The same online.
We will, yeah, the same online. So name, age, and probably
Phone
phone number,
number,
email.
email.
Either one, if they want to provide just one, that's fine. And
Okay.
then which station they want. And then from that, we will tell, like, I need two volunteers who are floating just to take them to the station
Station.
that they want, which station they want first. On the other hand, those people who are waiting for the outside the station, they can guide us. Like if there is a station that is very busy, so we will not send more people.
Yeah.
We will, direct them like to the other station that they. The best and easy way to direct them is whenever those stations are busy because it's one-to-one,
Yeah.
just direct them to the first aid because first station will be not one-to-one. There is
Got
no
it.
privacy, there is nothing. So they can come learn something while they are waiting for that other station.
Got it.
Okay. Uh,
So how about the payment? Everything's online
oh,
or
so no, the payment will be
in
on that
person?
registration when they come and then register. So you will take their payment cash.
Okay.
Or we have the reader also. They can pay, we have the reader with our phone. I can provide like more readers,
Yeah,
Sequoia readers. So we will have like three or four, and then
they
they
can.
can just like tap.
Okay.
And then we said the payment is $10 only for the whole event. Uh, what else like regarding the registration? And then they will go third step to the vitals. So all of them we are offering vitals, except if they don't want, like, people who will come for mental health.
Yeah.
Probably they want directly to go there.
They don't
Um,
need vitals.
so probably they don't need vitals, but because it's a screening, we offer vitals because they
Mhm.
don't know. Most of them, they don't know like what's their blood sugar. They don't know like what's their high blood pressure. So we are offering vitals for all of them, including blood pressure, weight, for those who, I prefer to get high to get the BMI because, the BMI is way too high.
Yeah.
Now they are more asking about the waist circumference and then not the height
Yeah.
and then the BMI. So we might offer that. We have a private room for the sisters that they can get checks there, and then our volunteers can measure their, waist and then
It's
offer
not
to them.
easy, if even if for the men. That's mean we need one of the volunteering men, one the
Yeah, that's fine. That's fine. We
it's
have a
not
lot of
easy, I
volunteers.
think.
If we need to be like more updated with the guidelines, the guidelines saying that BMI itself is not very reliable, but
Okay.
we will see like how that will work. We
Okay.
can the height, probably we will ask them if they know their height, that's fine. If they don't know, I will prepare like a height measure, you know, um, nearby, and then they can just stand, and then we will see what's their height.
Okay.
Um, so the blood pressure check will be for men in that big room, and for the sisters because sometimes we need like them to be exposed like on the skin, so we can take them to the other room for a privacy. The blood sugar will be also on the same
Mhm.
place, so they will get their blood sugar, all of them, if they are fasting. So we will advertise that please come fasting
Mhm.
if you want your blood sugar checked. Okay. Anyone with high blood sugar, we're gonna offer for them to see, um, that diabetic section. And with that diabetic section, I think I talked to Manal about can we put the nutrition advisor with that? So we have probably somebody who will talk to them about nutrition. That can be um, I don't know, like a doctor, one of the internal medicine doctor, or it can be one of our, I don't think we have dietitian in our, um,
There, there
oh,
was this volunteer. I mean, Huda's sister-in-law. She's a
okay,
dietitian, and she reached
great.
out and said she's interested in volunteering at EIXSYS. And so I asked her to fill out like the form, and I was talking to Brother Ijaz about like onboarding her. So maybe I can ask her if she's available.
So definitely, she will be like a great helper because,
Yeah,
we will tell them like we have a nutritionist that will help. She can sit with Dr. Asmat, who is our endocrinologist, and
yeah.
then help with that.
Okay.
For those who want like to talk about, weight, we will not tell them like you are. So we will never say obese or fat. And this is not a good word. So we will say you are overweight. And if you want to go with what we call, weight management clinic, so we'll call that's weight management. It's gonna be also with the dietitian later,
Yeah.
but the dietitian, I will let her talk more about, you know, mainly diabetes, and probably I will ask her for blood pressure. We know that blood pressure is all low salt diet, so it's easy for even for any provider. So I will let two internal medicine provider to run that overweight well, we'll say weight management clinic.
Okay.
So there is a station for weight management and there is station for diabetes and pre-diabetes.
Got
Mm.
it.
If they say also high cholesterol, so that will be the same endocrine, diabetes, pre-diabetes station, because the dietitian will talk to them about the low cholesterol diet. And then I bought many educational brochures. I think I bought 50
Hmm.
that we can probably go over with them. I don't know like how, and then we can probably just give one of them. Mm, I will receive them probably next week. And if they are very helpful, and I will buy another 50. So we'll make like even 100.
Awesome.
So I think we covered the vital signs, we covered the diabetes, we are covering like the weight management. Um, Equipment. So for the blood pressure, because we might get, um, you know, five, six people coming for registration. So I need blood pressure machines. At least I don't know, like how many machines do you need? Probably four, five.
Okay.
Uh, we'll get also like two two or three manual. So those who have high blood pressure,
Sure.
yeah, we might.
Okay,
Um,
we can
mm,
bring the one at NMCC, one in Leander,
yeah, we
and we
can
have
bring
one in
them.
our office.
Yeah, so that will be three
Yes.
manual, and we'll help like to do
Yeah.
the manual also. Um, we don't need to check temperature because they are not sick. So we're gonna check blood pressure, pulse rate, um,
Wait.
um, pulse ox, which is oxygen
Mhm.
saturation, and the weight and the height if they don't know their height.
Okay. Got it.
Mhm. For the children's station, so we will check their vitals on the same place, and then we'll send them for the physical. We did that in last health fair. The physical will be a special station that has a pediatrician there, and we will have also eye check. to check their visual acuity, and we will have, they need to bring, probably we will say, bring the school form for the physical, and then we can sign it. Um, and then we will put our, clinic name, and then that's totally fine. That's acceptable. That will help them to have a school physical. Usually, the school physical they need it in the beginning of the year,
Yeah, not now.
not now. But some of them they will start another, you know, sports season, and then they want from them another school physical. So we are totally fine with that. Uh, what else like for the children? Probably for immunization, education about immunization. We have two age group for the immunization. We have the children like before adult, probably like before below 20 or below 18. And then we have the seniors that they need immunization. So I think I will combine immunization with the pediatric section so we can
Yeah.
teach them about the immunization. Um, and mm, for the other group will be in the senior health. When they talk to seniors on something, there are probably RSV, there's shingle, that they need like to get educated about the importance of this. Mm. For I think because anything for the pediatric station. We will get more information from Dr. Ramlali and Dr. Rahman. We have two pediatricians, and then Dr. Nazia. So that's three pediatricians actually. That's
Awesome.
helping. And then myself.
Um,
Mm.
for the breastfeeding support one, like would that be involved in this or
Yeah, so that's probably we need to talk about that is because the breastfeeding is mainly like for women, and
yeah.
I wonder if we have a big room that I can probably put the breastfeeding on the other side. I don't know, like, do we need some privacy for that breastfeeding? I don't want, because we might not have a lot of people
Yeah.
for that. So I don't want that provider to, get bored because nobody is coming. So
Yeah,
I
yeah,
will
yeah.
combine it. I will combine it
With the mental health, maybe.
with the women health
Yeah.
or with the pediatrics side. Yeah. Well, ask them.
I think
Okay.
women, because both of them only women.
Okay. Okay. Yeah, we might.
Yeah, maybe the
Yeah.
pediatric, maybe the
Yeah, we might.
dad, he bring his kids
Yeah,
or something.
we might just like
Yeah.
put it with the women health.
Yeah.
Um, and then with the what we said, yeah, breastfeeding, lactation, and then we said like Noha is not here, so she has a friend that we Minal will
Yeah.
contact,
She
and she's
already contact us. Yeah,
and
I
then
think
she's coming,
maybe yes. Yeah, she will
maybe, or
take.
yes, she need
No,
to confirm.
she need to check her schedule.
So she need to confirm, like
Yeah.
to say, because we will probably
Mhm.
not offer that if we have a lactation specialist, we can offer lactation education. It's gonna be like very limited numbers,
Yeah.
because we don't have a lot of mom who are breastfeeding,
Yeah.
but even for the younger who are just get married or something, we can
Yeah.
offer that education for them so they will be prepared. Actually, from my experience, whenever you talk to pregnant lady or like even newly married about lactation, we will get success of 60 to 70% of breastfeeding
Wow.
about. So it's really like mainly educational.
Yeah.
So I will highly recommend that whenever if she confirmed. Um, anything about that station? So lactation will be with the women
Women.
health.
Yeah.
Okay. Um, so immunization will be with the pediatrics, and then lactation will be with the women health. So let's go to the women health now. So women health will be offering, advice about screening for like breast cancer screening, mammography, the yearly mammography, and then how our sisters will do self exams for their breast, and probably it's more education about anything related to the period, cramps, and something like that, and bleeding, and how to manage that. And the same that you talk about, like it's your talk, which is postpartum depression and you know, coping with work and family and how to deal with that. So that will be run by Dr.
Linda.
Linda, but she needs help. She needs help also. I might put you with her, Ayla.
Yeah, because
I
she
would
Um,
love to. Yeah.
yeah,
yeah,
because you did that lectures and then so
understand.
it's nice like to be with her and then
Mm.
help with some education and then you can
Yeah.
coordinate with her. Mm.
Yeah.
Mm. And then probably the lactation specialist also like will be there. And what else? We said that's it for the mental health.
Mhm.
Sometimes if you screen for postpartum depression or like that's a lot of stress on the mother from the work side or something,
Yeah.
we can refer them to our psychiatrist.
Hmm.
So they
Okay.
can probably be seen by women health and after that can go and then talk to the psychiatrist.
Okay.
Mm. Um, so after that, um, we need also like to include because I had this experience, like most of the people who does not have insurance, where they go to do mammography. So I contacted, um, Lone Stars, and then they referred me to a bus called Mobile Bus. Is it like
Pink bus.
pink bus? And that's free. So we need probably to get a flyer from them
That,
and just show it to the people. They need to call and schedule, and the total mammography will be free, which is very,
Wow.
very, very well. It's really like, it will cost 300 or something, and then they are doing it for free. So it's really like very helpful. So we need somebody like to get educated about that so they will guide people. I think my estimation is probably 70% or 80% of our sisters are not doing
use
that
the pink
mammography.
bus.
Yeah. So big pink bus. Yeah, probably like you need to, mm, share flyers. We can print a flyer from their website and then just give it to the people and then
Yeah.
educate them about the importance of that. This is totally 100% preventable cancer that we can prevent it in the future, inshallah, for all our sisters.
Yeah.
And I don't think we have a good education for all our sisters regarding
Mhm.
that. If you do survey, you will see a lot of them. They don't know when to go and do it, at what age, and then they don't know where to do it if they don't have insurance. And then what's the follow-up like after that? So all of that education will be great. I might ask you like to do that to
Yeah. No,
educate them about mammography.
I
Yeah.
can definitely manage like this part as well.
Yes. Yeah.
Okay.
Uh,
Yeah.
I think let's go to the senior health clinic. I contacted two doctors, Dr. Khalid Khan, who is a geriatric specialist, and Dr. Walid Abdelal. Both of them are active members of our community. Dr. Khalid said that he will be there, but he is not joining us with a lot of WhatsApp. I mean, so I probably will do a private session with him and then tell him like what we are doing. Dr. Walid, he's in Egypt now, but he's coming in the next 2 weeks. So he said like he will be there. Um, I don't know. I don't have a lot of information about what they will offer, what kind of educational material they need. So we need probably to follow up with them. And then I will take care of that, put my name, that I will get how many volunteers they want, and then what educational material they want, and then how that will work. Because I know both of them.
Okay.
Um, for pain clinic, pain and joint clinic, um,
And physical therapy.
That will be
So
separated. No,
separate.
no, we'll separate that. So pain and joint clinic will be run by Dr. Hassan Chaudhry and Dr. Neda Al Makboul. Dr. Hassan Chaudhry is a pain specialist, and Dr. Al Makboul, she's a rheumatologist. She offered to talk about osteoporosis and prevention of osteoporosis in all our, sisters who are reaching, age 55 and above. So also that's a very important missing subject from all our sisters.
Yeah.
What kind of exercise they need to do to prevent that, and what kind of medication they need to take. Some of them, like they have very fragile bone. It's a lot of educational things. And then whenever there is a pain, which I think this clinic will be busy
Mhm.
because 90% of us, we have like some pain in our like joints or something. So Dr. Hassan and even Dr. Nada, they work with us in the clinic, and then we can guide them what to do and how to deal with that. And after this clinic, if they need physical therapy, so we will send them to the physical therapy clinic, physical therapy station. Physical therapy station will be run by Dr. Muhammad Khalaf, who has a physical therapy clinic in Cedar Park, and then we are referring many patients to him. He was with us in the last health fair,
Mhm.
and he said, I will join. I was planning to include our health fitness educator in the masjid, Brother Salman, but he is in Pakistan. So I don't think he will be joining us. So probably only Muhammad Khalaf will run that.
How about his wife?
Oh, yeah, probably will advise his wife to, because his wife is also a therapist. So if he can, I don't know if they have kids or something. But if they can, both of them come, especially like, his wife can help the sisters. And then,
Yeah.
so we might need also like a big room for them because they need space. And then, I will probably contact them personally to see if they want that room to be, furnished by anything. If we can, if they need mat or if they need like some sort of table that they can sit the people to do some, teaching them some exercise or something like that. So
That's
that will be the physical therapy clinic. Definitely, that physical therapy clinic can be reached immediately. If they request to go to the physical therapy, they can go directly, or they can, be referred by the pain and joint clinic. So that's two options for those that to reach. Did we miss any other clinic? Any station? No, I was checking. And any suggestion for any other volunteers? I am seeing Basma.
Dental.
Oh, dental. Yeah,
Dental.
we will talk about the dental screening. So Dr. Sinan Abdel Qadir, he is our referral dentist. He offered to come and do an exam. So he will buy those disposable mirror, and then he will examine all the people who are willing to come. We will do his station in our clinic because he need a couch to lie the patient down. So I need a volunteer that work with him. If anyone from your volunteer interested in going to dental school,
yeah.
so that will be the best like to, you know,
Okay.
mm, and then they even in the future they can shadow with him in his clinic.
Yeah.
Mm. So we need that, and then probably that will be also like very helpful if we know that if they requested that in their registration link that we need a dental screening. Uh, so can you check with them? So if they can, say that we need dental screening, so we can move them also like in the
Okay.
beginning, and then probably in the in the in the waiting area or something, we can have people, sometimes people will come and then they don't know where to go. They want to see all the station and they don't know where to go. So I need somebody who run between you know, all the stations and know like which station is, you know, have more availability. We have hockey talkie. Should we use them between the volunteers so we can just talk all of us on the same line and then we will say like any station free we can send people and we are doing that in our parking group whenever
Mhm.
we prepare parking for the for Ramadan. So
Yeah.
I can get those hockey talkie and then I can give it, probably we have 4 or 5. I can give it to each volunteer in each year station. And then they can probably guide us, like if they don't have any people coming, so we can send people to that. So probably
Yeah, I
put
feel
that,
like that's a good idea.
yeah, so that walkie-talkie like will be like very helpful for communication.
لا غرف النوم نظيفة مو يعني ممكن نجيب الأغراض ما تفتحها نجيب نحط.
Go. So, probably we talked about the logistic of that. So I need from now, I need an advertisement for that. So I need people to help us with the advertisement. We have our brochure and flyer. So where do you want to advertise that? So I can ask Brother Ijaz to send it to the masajid because it's from Access. Our masjid also will send it to I think local community. We can send it to through our groups, like multiple groups. Manal has sister group that have
Yeah.
I think um, more than 100. There is also a women group. I think that she's like Austin women that has 200. We can share that with them. So we need a good advertisement to get good number of people. Um, Amin told me that he got a confirmation from the mayor that he's coming, Cedar Park mayor. He's coming to, volunteer and help us. I think I will probably put him on the registration so he can see the people coming and then he will probably like be in the front. Which is a good like to have other city officials. I think I will ask ICBC, whoever city official they have connection with. I think the police department and then the firefighter people, they comes to our clinic. I think they come every Ramadan to get um, iftar there, so we can probably share that with them, so they can come and join us. So that's for the advertisement. Anything that for the advertisement, what to do?
I
Um,
did want to ask, in terms of like getting like the police and people to the clinics, I was thinking about like if there are any, I don't know if there's a lot of like refugee populations in the ICBC community, but maybe I was wondering like would they be scared to come if there were cops there? Um, or do you guys think that we should still invite the police?
So, definitely the presence of the police, they are just like, they will never ask people identity or something. We are not
Okay.
asking people even, we don't request a photo ID from the people even.
Yeah.
We don't
Okay.
ask them about that. So nobody knows about those refugees. Nobody knows
Okay.
about who is coming, who is, um, it might be scaring them, but as I said, they are coming as like a guest, so they will never do anything. You
Okay.
know, we will have probably a security outside the masjid because it's a
Okay.
big, but nobody will. I think I am seeing Raneem raising hand. Raneem, you are welcome to talk.
Hello, yes. I just wanted to mention maybe another good advertisement would be to like advertise some like of the medical clinic, the event in like some Islamic schools. Like I used to go to Renaissance, and there's a lot of people there who are connected to like these masjids. And I think it would be really good for them, especially for like the kid station, the children like station. I think that'd
Great,
be really good.
great. That's a good idea.
Yeah.
So, are you still running like have connection with them? Can you share that flyer with them?
I do. I used to go to Renaissance just like a year ago, but my brother and my dad does have connections with Renaissance Academy, and I think somehow I can let a friend know, or my dad also might have connections with APA and stuff like that. So I'll let him know and see what kind of connections he has.
Great. Yeah, APA, I have connections with the principal, and all my kids went to APA, so I have a lot of connections with them. So I will reach to APA and help with that, but I need somebody from Renaissance. I don't have connections with them.
I have.
Yeah, I'll let him know
Yeah.
and
Yeah.
let him
Renaissance.
know about that.
So Minal also
I have
have
my
connections like with that. It's not a bad idea to get the invitation from different people.
yeah.
Okay.
Yeah.
And I have two groups. Every group is like 400 people on it.
Yeah, we are
So,
talking about specific the schools,
oh,
the
okay.
Islamic
Yeah.
school. And then, Islamic schools are very, very good to get those kids. However, probably most of those kids who, go to a private school, probably they have insurance and then they got their physical without any problem. So we are trying to target people who are, refugees and something like that to um, get their physicals because they don't have insurance and they don't have coverage. But we are welcoming all of them. Okay.
Yeah, that makes sense. All right.
Yeah. Mm, Anything else about advertisement, Ayla?
I think
I think,
Shabiba had her hand raised if you wanna
yeah.
start.
I looked at our flyer and then I found that our flyer did not mention the time. First
Okay.
thing this morning.
Oh,
Brother Mohsen is out of the country, but I don't know like if he can respond and then change that flyer before we share it,
Okay.
or um, we can share it and then we can share it again with the time actually, or like in the registration,
yeah.
it will
Same.
show
Yeah.
um, from what time to what time. It said in the morning,
Okay.
but
You can say
it's
the
not
time.
saying. Yeah, we did not say the time.
Okay.
Um, so probably that's. I think I will contact him and then see if he usually like respond even from India or from anywhere. Yeah. But if it is difficult, Brother Muhib will put that in the registration, and then whenever you share it, you will put like under it's from 8:30 to 12:30. So the officially it's gonna be like
30
from
to the prayer.
8:30 to 12:30 or to the Dhuhr prayer, we will say.
Okay.
Okay. Anything about advertisement? Any advice?
For you.
Waiting for me? Okay. Okay. Uh, I think that's it for this advertisement. So, Ayla, probably you need to, I know that you are busy, but like, can you have a list for the volunteers? How many volunteers are
Yeah.
interested and
I
which
can like
one?
write out like what we just went through today
Okay,
and have like volunteers send me what
just
they're
sign.
interested in. Yeah.
Yeah, and
Yes.
if they under 18 or above 18,
So are
because we
we,
need to know.
so the under 18, where are you gonna put them? Because I don't want like
We
under
don't need all
18 with the
of them.
station. So registration is easy, like for the under 18. From 16 to 18, if
Yeah,
anyone like
we
want
don't need
that
under
that
16.
that they work with us.
Yeah.
So it should be they worked with us.
Okay.
And from 16 to 18, they can help with the registration and then, handing tickets to
Yes.
the people who are waiting and something like that. Okay.
Okay.
But 18 and above, they should have
Help the doctor.
help with the doctor
Mhm.
stations and
Yeah.
something like that.
Okay.
Okay. And
Uh,
then for those volunteers, like what we need to buy for them. I know that the ticket,
Just that.
probably name tag.
yeah.
We need to buy the name tag.
Okay.
Brother Ejaz said just that we wear access
Yes. We
t-shirt,
give
all of us.
Online
uh,
volunteering.
but we don't have a lot. Do you have a
I
lot?
have a lot.
So we have a lot, so we need to know their size, and they need to
They
stop
need to
by.
come to ICBC.
They need to stop by the clinic and then get that shirt.
Okay, I can coordinate that with them as well.
T-shirt, yes.
Yeah.
Because we have different. Do you have a lot of small?
Yeah.
Because most of us like are small. Okay.
I have a small, medium, large, X1.
Okay.
So,
Yeah.
sorry, I
So,
know, Shabiba,
yeah.
did you want to ask your question? Sorry, you had your hand raised for a while.
No worries. Assalamualaikum. I was kind of thinking more about the mental health booth, and I was wondering about the possibility of maybe including educational brochures for that one as well. And
Men,
since
men, okay.
yeah, just an idea. I think that could be helpful as like sort of a takeaway from that booth since it's less hands-on. And maybe since we are kind of looking towards focusing on like refugee groups, and of course the Muslim community is so diverse already, I was also wondering about maybe like targeting topics about like stigma or warning signs or preventative measures. I was wondering if that might be helpful as well.
Definitely. So what I will do, I will let Manal arrange that with Dr. Afshan and ask her what kind of educational material she want. While I'm searching in Amazon, I found a mental health awareness pen. I don't know like if it's a green pen. Is the mental health green like the pink for the breast cancer? If that's a good idea, it's not very expensive. So probably like 50 pen, $25 or something. So we can buy them and then we can give each pen with educational material if you like that idea.
I agree. I
But
feel like that would be really helpful.
okay. Yeah. We'll probably just ask what kind of brochure educational materials you want, and then we can print them or like we can buy them if there is already like there something over there. Remember, our people, they don't like to read a lot, so we need more pictures and then small lines. So I don't want like a full, one paper of, just thousands of words. No, nobody will read it, including myself. I will not read it if somebody hand it to me. Okay.
Awesome. Oh, also I wanted to ask, so are we not doing the CPR classes in the evening and the afternoon anymore?
Yes, we are not doing that
Okay.
because that's required a lot of arrangement, and then
Okay.
it's better to separate that because it's
Got
going to
it.
be a lecture and hands-on, and we don't have that facility yet.
Okay. No worries.
Yeah, but we
One
will do
one
it. We will do it sooner. I think I will do it probably
Before Ramadan.
before Ramadan, like a week before Ramadan or something. So if
Okay.
they ask about that, we're gonna tell them that we will do it like separately.
Okay. And then one other thing I had an idea of is that if like EIXSYS has an Instagram, maybe we could post the flyer on Instagram, and then that way the volunteers can like repost that on their stories so that like
Okay,
the undergrad and like the more college student people can come as well.
great. We know that that's the best way of advertisement. Yeah. Yeah. I think they have
Yeah, I
Facebook
think
and then
it's
they have Instagram.
Yeah,
Uh,
maybe posting it on both would be helpful. And then I
okay.
can definitely repost it like on my personal challenge, my personal accounts when they post it on Instagram.
Okay. That's totally fine. Probably you can reach to, Ajaz.
Yeah.
Okay. Reach to
yeah.
Ajaz and then let him post that
Mhm.
in the Instagram. I
Okay,
think
perfect.
probably just wait for me to get if Brother Mohsin want like to add, if he can add within
Yeah.
the next 2 3 days the time.
Okay.
And then we can post it. If not, probably we'll post that whatever we have, which is
Okay.
still very good.
Okay.
Okay.
Awesome.
I think we reached to the end. Anything else?
Um, no, I can't think of anything, but I will definitely like consolidate all of this and then reach out to the volunteers who should me that they're interested and ask them like if they have preferences or assign people to things as well. Um,
That's right. Um, Before we finish, do you think that it's a good idea to do like a weekly meeting, or like should we
No,
just
not
postpone
weekly.
that? Like in 2 weeks, we will do another meeting to see like what's the update. I know it's a holiday and a lot of
Yeah,
people are.
now it's like final
Yeah.
Yeah.
When you're gonna finish your exams? Are you
Mine?
finishing? Yeah.
And after that, she's on vacation.
Oh,
So let her enjoy her two
okay.
weeks, 3 weeks.
So
Yeah.
well, 3 weeks no, we will be like
So
far
maybe
ahead.
beginning of
So
January.
what do you think? You're gonna tell us like when should be our next
Yeah.
meeting?
So I finished my finals today.
Okay.
Maybe we can do the next in 2 weeks.
Okay.
When she's
So
back.
2 weeks. 2 weeks will
Yeah,
be fine.
Yeah.
around
Okay.
the
Brother
I
Ijaz is
mean,
good.
I feel like 2 weeks is good. Maybe 27th, 28th.
I am so sorry. I am in outside the city. Is I just saw the message. I thought, okay, I will catch the tail end of it. I'm so sorry. But
You
if
will
there
No
is
be
worries.
punished,
anything,
brother
Oh,
Ejaz. You will be punished.
I know I will be punished. So I'll come personally. Is apologize you. How about
No
that?
problem. No problem.
okay.
So,
Yeah.
so one of the major goals that we want to is the advertisement. And Ayla will reach to you, and then we'll talk because we talked about that like
Okay.
in more details.
Okay.
She will reach
Cool.
you personally, and
Okay.
then okay, inshallah.
Cool.
Jazakallah khair for
Okay.
joining.
No problem. Okay.
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 Okay. Yeah, Ayla, probably you can later post like our next meeting in 2 weeks, inshallah, and
Okay.
then prepare the minutes, inshallah. Take your
Awesome.
time. Okay.
Yeah. Okay.
Yeah.
In the meantime,
Jazakallah.
inshallah, I'll try to finalize the volunteer list and get everything in by then. So,
Jazakallah khair.
yeah.
Inshallah.
Okay.
Okay.
Assalamu alaikum. Thank you guys.
Thank you.
Alaikum salam.